Over the last 2 years, emergency departments have seen an uptick in the number of patients that walk through the door.
Early on when COVID started, there wasn't a great access to outpatient resources because offices were closed. And even now
that most healthcare options are available, Dr. Lux says people should decide where they need to go based on their symptoms.
if somebody has a severe illness, chest pain, feeling lightheaded, like they're going to pass out, severe injuries,
Breaks, bodily deformities, chest pains, and shortness of breath should be treated right away.
anytime it's life threatening, anytime it's something that is where you really feel you need immediate help, the emergency department is the place.
But things like colds, coughs, sprains, and strains can be treated at the walk-in.
Minor upper respiratory symptoms, anything that seems a little bit less severe that can be done as an outpatient, maybe even in a family medicine office, are definitely things that can be served in an urgent care as well.
Urgent care typically isn't open 24 hours a day, and though some illnesses and injuries can be inconvenient,
If it's something that can wait till the next day, if it's a less severe symptom or complaint, it probably would be better to not go to the emergency department for that sort of a thing.
doctors say your primary care provider can help you figure out where you need to go.
Something to help you with that, where you can say, I have X complaint, and what do you recommend? Another thing they have to bear in mind also is if you do go to an urgent care, the urgent cares in our area are very good about saying this is something that we feel should be treated in an emergency department.
Calling the emergency room for medical advice isn't recommended.
We're not really supposed to give advice over the phone on if you should go to the ED or not, because it's too hard to make that determination just based on a phone call.
Health emergencies like a stroke or heart attack are time sensitive, and Dr. Lux says you should call 911. The hospital will know you're coming and get you in immediately for care. For Arnot Health, I'm Lexi Cutmore.